Hello and welcome to day 3 of the Lupus Forum Daily Highlights for ACR 2025. I'm Professor Ed Vital from the University of Leeds in the UK and Chair of the Lupus Forum Steering Committee, and I'm here to recommend some of the most interesting research being presented today at ACR in Chicago. In poster session C, Anka Askenazi is going to be presenting results on cenerimod on 4 main clinical items of the SLEDAI-2K score in SLE patients in a phase 2b study. So we can look at how that drug works on different organ features. In addition, in that session, Zahi Tuma is going to be reporting on dapirolizumab pegol on quality of life in the phase 3 trial of that drug. Always difficult outcomes to demonstrate in these trials, while Eric Morand is going to be showing achievement of treat-to-target measures with upadacitinib in patients with SLE from the phase 2 randomized SLEEK trial. Also of interest there, Richard Fury is going to be showing efficacy and safety data on zetomipzomib from that phase 2b Palisade trial, and Sarah Sheikh will be showing Reset SLE. So that's a clinical trial on an autologous CD19 CAR T therapy for both non-renal SLE and for lupus nephritis. All interesting emerging therapies at different levels of development there. There's further work by Chun-Li Mei in poster session A investigating A319. That's a T cell engager, so a CD3, CD19 T cell engager. And there's also Jingzai Zhao showcasing an update on an anti-CD19 CAR T therapy in refractory SLE from an open label study. So those are 2 new B cell killing approaches, one of them cellular and one of them a bispecific T cell engager that tries to combine the convenience of monoclonal antibodies with the efficacy of a cellular therapy. I also want to highlight Rajay Nan's poster on the real-world comparative use of anifrolumab in SLE and CLE, and there's lots of this at the conference, real-world evidence that tells you things about patient types and situations not seen in the normal phase 3 trials, in this case CLE that exists without the presence of systemic lupus as in anifrolumab's usual license. Finally, I've got a poster there as well. I'm going to present about obinutuzumab in lupus nephritis, showing some post hoc data on its efficacy regardless of baseline serological markers. And in the afternoon, Grace Hay is going to present about the comparative risk of all-cause mortality in patients receiving belimumab compared to oral immunosuppression in non-renal SLE. That's real-world data. It relies on propensity matching, but it suggests better mortality outcomes with belimumab than with conventional therapy. Again, something that's been difficult to demonstrate in the normal phase 3 trials that we see all the time. I hope you enjoy this 3rd day of ACR. Do remember to visit us over on stand 2102 and make sure to follow us on X and LinkedIn to keep up to date on all our activities here at ACR. I'll see you tomorrow.